Welcome everyone to Power Monday. So I'm actually Yvonne from Singapore. We have a very special guest, Dr. Chia, today with us, and she will be actually explaining to us the power of phytochemicals. We have a very amazing product, JoeGenEx, and JoeGenEx is all about phytochemicals and epigenetics. So this might be a mouthful, and you might not understand what is epigenetics, what is phytochemicals, but Dr. Chia will actually explain to all of us today. Okay, so let me introduce Dr. Chia. So Dr. Chia, she's actually a medical practitioner. So she actually served in the medical line for the past 15 years, okay, practicing in Kuching, Sarawak. So currently she is actually a general practitioner in a medical clinic, and she also co-manages nursing homes and confinement centers throughout Sarawak. Okay, she actually has experience in emergency medicine, family medicine, health screening, maternal and child health in government and private hospitals in Sarawak. So, what's her story? How did Dr. Chia actually know about Thanks Eye products? Okay, so she was actually introduced by Bibiana Lam, our leader in Cebu, who is also her business partner in the confinement center business. So at the time, Bibiana was already postmenopausal, and usually after menopause, females will actually deteriorate a lot after menopause. But Dr. Chia was so surprised because every time she see Bibiana, she realized that hey, Bibiana's face was glowing, and every day she looked better and better. So she was very surprised and very curious. So she actually went to ask Bibiana what was her secret. And then, of course, she was introduced to some of Thanks Eye's products. And not just that, she started taking Thanks Eye products in May. And then also, Dr. Chia has, her parents are about 70 over years old, and her mom couldn't walk properly, has insomnia and some chronic illnesses. So she actually also let her parents start taking the Thanks Eye products and have benefited a lot from it. So without further ado, let Dr. Shah actually explain her story in more detail for all of you. So let's all put our hands together and welcome Dr. Shah.
So much for joining me tonight. Okay, I'm Dr. Chia, currently practicing as a general practitioner in oh hi Dr. Daniel. Right, general practitioner in Kuching. Okay, so I'm involved in family medicine, elderly medicine and health screening for the past 15 years, and also maternal child health. I co-manage in all these centers. So a bit of a history. How I get to know Thanks Eye, as mentioned by Yvonne, I saw my best friend. Okay, this is my partner's mother. She's more than 60 years old. And postmenopausal, usually our condition deteriorate very fast, tremendously. So looking at her appearance, she is just getting better and better every day. That's I was asking what is her secret. Okay, so my parents are 70 years old. They are considered elderly lah. Okay, so they have a chronic metabolic disease like high blood, diabetes, fatty liver, and I'm sorry that he just recovered from invasive prostate cancer last year. So his immune system, their age, and with all the chronic diseases, the immune system is on the weaker side. So my concern is how to stabilize their blood sugar, their blood pressure, and their general condition. So after taking, it was quite fast. They have been taking various different supplements from other brands. So, but this within 1 or 2 months, I can see very good changes in my parents, and they themselves provided me with good blood results. So I was very convinced, and I further done my homework and research about especially JoeGenEx. So throughout my medical career, I came across a lot of chronic diseases because I'm a general, a family doctor. I would say that a general practitioner, and the population involved in these chronic illnesses are getting younger and younger. I think mainly it's because of our environmental factor, our genes, and our lifestyle. So I strongly believe that prevention is still better than cure, and we have been seeing a lot of sick family members and friends suffering from our family. And I think we can do something from now on for our health. as because we are responsible for our health lah, right? So let's start this. Okay, so basic about human structure. Okay, always start with this. So we have to understand what we are made out of. Okay, we are made out of, our basic unit is our cell, different cells, from head to toe, inner, outer. We are made out of various cells, 30 to 40 trillions in our body. And the basic unit is our cell. One by one, they specialize in a different way. So they are different function, they look differently. So most of these cells, they will group together. They will become different tissues. Okay, my muscle tissues, my bone tissue, and all kinds of tissue. And the different various tissue by these specialized cells, they will group into become an organ. And with a few related organ, they will form a different system. Yeah, all this different system in our body. I think we are familiar with that. And which accounts for us. We are very complex. So everything is interrelated. But I would say if we get to take care of every cell, okay, to delay the aging process, we can subsequently delay a lot of chronic medical illnesses, which benefit us. Okay, so this is our cell, okay, in a nicer way, and this is a graphic, this, and this is under microscope. This looks alike. So you can see our normal nice cell. We have our nucleus. They have different colors. They have substance inside, and it's circular. It's nice. Okay, so what I want to say is aging is inevitable. I cannot stop aging. That there's no miracle happening around, but we are aging rapidly nowadays because looking at our lifestyle, my stress, okay, my environmental damage, my toxins, my lifestyle, my chronic inflammation, especially sugar related. So all this speed up my aging process very, very fast. And when my cell age, what I call aging cell, old cell, you look at it, it is not the nice circular kind of structure. And look at the inner part, it looks hollow. It doesn't look the prettiest, and it doesn't look like it can function properly. So this is our aging cell. So if we can protect my cell as a whole from all these external damages, and eventually I protect myself, I can at least delay the aging process. Okay, so more detail go into our cells. Okay, our whole immune system is run by DNA code. Okay, I think everyone heard about it, know about DNA code. We can't choose what to inherit it from our parents. Okay, one set, half of it from my mother, half of it from my father. So all these, they are our genes, our codes, all is in our cell, is surrounded in the nucleus. And this, we have different pairs of chromosomes, and they break down into this is our DNA. And the smaller unit is our genes. This is the segment of the DNA. Okay, small DNA, all the segments. So this is our life story. So they already determine our life story here, and we are all kind of like coded. Okay, and that made who we are today. And we cannot, the thing is from our parents. We can't choose what we inherited. Okay, but maybe there is some science proven, a research proven studies that we might get to choose what kind of gene to express, since we cannot choose the coding inside. Okay, let me explain further. So have you ever wondered, these are identical twins. Okay, at the younger days, identical twins, they have the most similar genetic content. Okay, identical twins, they share the most similar genetic contents, even more similar compared to my siblings and me. Okay, so younger days, not much of environmental difference or changes. So most of them, if they are having almost the same environmental circumstances to grow up, they look alike. Okay, but as we age, okay, the environment, our lifestyle, the stress, the toxins, okay, even though we have the similar genetic properties, but these twins, as they age, they are twins, they are identical. but due to some external stimuli, external changes. So these ladies, maybe some of her gene chose, we can consider the bad side of the genes, they chose to express themselves more than her siblings, although they have very, very similar genetic content. So this shows that environmental factor is one of the reason. Okay, external, it is sometimes we decide, our code decide what we are going to express, but the environmental factor outside, they are the ones they will how to say, they will determine, they will affect how our genes are being expressed or being suppressed. We can't choose the genetic content, but if there's good genes and there's bad genes, can we enhance the good genes? Can we suppress the bad genes? And what is the factors that is actually affecting our genes to be expressed? Okay, so I will touch a little bit on epigenetics. Okay, so epigenetics, or what we call gene expression. Okay, so we are what we are, and this how my gene express. I have black hair. I'm Chinese. I'm fair. I have a big teeth. I have small eyes. This is being expressed. Okay, so I'm unable to change my genes from my parents. I can't, but we can actually change how our body read my DNA content and to express whichever characteristic inside. Okay, so actually they have different methods. This I will elaborate later on. But they have also other environmental factors. Some we can modify, some we can't. We can't change, like age, of course, we are getting older. Gender, we can't change. Race, environment, sometimes it's a bit difficult. But others, like those modifiable changes, is like disease, stress, medications, toxins, alcohol, cigarettes, all these can affect how my gene is being expressed. Okay, so how my gene is being expressed is epigenetics. Okay, remember the chromosome I mentioned just now? Okay, I break down into my DNA, and this is the segment of my DNA, the small subtype, and these are all genes. Okay, so how our body choose which to express, which to suppress. Okay, they have a few methods. Okay, the first, okay, this looks a bit complicated, but actually it's very easy to understand now. DNA methylation. Okay, methyl is a kind of a substance, a kind of chemical. Okay, methyl. Methylation is I add methyl in that DNA. Okay, so this chemical, our body will add to this, my DNA segment, my gene segment here. This is to block. So once it is here, it is like the blockers, to block and to turn off the signal, so it will be expressed, something like that. Okay, so this is one of how my gene is being expressed. So when I want to express that gene, maybe this, we call it demethylation. This substance will be gone. I can put it in or put it out to choose to express it or not. Okay, next is histone modification. Okay, histone is a kind of protein in my gene, segment. This protein, I would put it as like a wrapping paper. Okay, it's a protein, they wrap around my gene. Okay, it's like wrappers. So imagine if the wrapping paper is very tight. Wow, so tight. And my gene, I cannot express my gene. It's like blocking it. I can't express it because it's so tight. But sometimes if I want to express it bit by bit, this histone, this protein outside the gene, they will loosen up a bit. Oh, I lose a bit. Okay, I can express my gene. So this is another type of how my gene is being expressed. Okay, and the third type is our RNA. Okay, it's a substance with my protein combination in my DNA. They act as we have coding and non-coding. Non-coding is like they decode, like the hackers. So they will attach to my gene, and they kind of like hack it, and my body is unable to code that part of gene and to turn off or suppress the gene. So all these three, these are the main methods of how my body express my gene. Okay, and it can be altered by other external factors, maybe not 100%, to a certain percentage, it can be altered. It can be either enhanced or being suppressed. Okay, just like computer. Everyone is familiar with computer lah, huh? Okay, so my computer is run by system code. It's a code. So we create a code. We want how my computer run it this way, specific way, we have this code. But sometimes we know that maybe safety reason or protective reasons, my system code must be protected by maintainers and antivirus software. So just to maintain it, make sure it is safe, make sure there's no error in it. So they can express, I want my computer that way. They express it in this way, that way. So our body is the same. Okay, so our body is the same. So with all these genetics, coding, decoding, express or not, okay, my body is just like a computer system. Okay, just like a computer system. So if there is a substance, after years of clinical research, there's a substance that can act like my maintainers and antivirus software. Is there any of it? Yes, there's a substance that can maintain, protect maintenance, and protection, and to repair my code. That is recognized by our WHO, phytochemicals. Okay, the 7th essential nutrients. Okay, before this, the 6 essential nutrients, carbohydrates, proteins, these are from food, our daily food. Okay, but this is something new, and we are having more and more clinical research towards this phytochemicals. Okay, this is listed as the 7th essential nutrients our body needed. We cannot produce it. We can only take it externally. What is chemicals? Okay, a lot of new words to learn now. Okay, so phytochemicals, they are chemicals by the plant. Okay, phyto is plant, chemicals is chemical lah. Okay, so it's like plant derived chemicals. It's from the plant originally. So I mean, not in the human system, it's from the plant. This is part of the plant's immune system. Okay, human body, we have immune system. Plant, wonderful, they have their own immune system as well. Okay, so it is complex. So these phytochemicals from the plant is the plant immune system, and this immune system is originally to protect the plants from natural disaster, from all those pathogenic microorganisms. They have virus, they have virus in the plants, they have bacteria, they have fungus, they have parasites, same as human body. Okay, or even environmental toxins, my herbicides, my pesticides, my heavy metal, and secondary non-nutritive metabolites, or in short, the waste from the plant. The plant have excreted waste as well. So plant needs this immune system to protect themselves. Okay, so when humans understand this, we take it plant-based. It's very safe. So recommended our daily nutrients, 60% is by WHO is from plants. 40% is either if you are a non-vegan, maybe from the meat-based. Okay, so from all this plant-based, we can get, what we can get is phytochemicals. And when we ingest it to our human body, the main function of phytochemicals is the same. They can boost our body's system against and to protect against any harmful substance. The same microorganism, bacteria, virus, fungus, okay, that can cause cellular damage, even more because of our environmental toxins. We are exposed to more of it, our lifestyle, and metabolic substance or waste, the food, what we eat, and what we being excreted out. So same as plants, we are using the plant's immune system to protect my own system. Okay, so this is phytochemicals. So nowadays, we are more towards phytochemicals. Okay, to share a bit on the evolution of supplements lah. Okay, since 1970s, I think the world health science, they recognize the importance of vitamins. But because initially our technology is not as good, so 1970s, they have single substances. And subsequently, they go into multivitamins. So you do not need to take so much of various tablets, And this also, everything mixed around, it will be easier for our absorption as well. For example, if I have anemia, my HB hemoglobin is low, okay, I am having iron deficiency. So previously, if I am to take to boost my iron, I have to take iron tablets, I have to take vitamin C to boost the absorption, I have to take folic acid, I have to take vitamin B complex to make sure everything, my HB hemoglobin runs well. So how many tablets I'm taking? 5, 4? Yes. So that there is a single substance, but multivitamins, they incorporate everything in one. Okay, but as now technology is more advanced, so after 2000, we start to look at phytochemicals, but at that point, it was single substance. But there is so many phytochemicals around. I don't think we are okay to take so many different tablets as well. That is the last thing I would do. So now we are looking at multi-substance phytochemicals, all goodness, put it in one. Yes, and it's convenient. Okay, we are looking at availability, convenience, and at a very affordable price. Okay, so our plant-based nutritional supplements, initially they go from capsule. Okay, capsule, they have to go through my stomach, the absorption, and they go through the pH 1, the harsh environment for absorption. Okay, and subsequently it goes into liquids. Okay, and nowadays we go into powder form. Okay, somebody asked why powder? Okay, so if I'm going liquid, one, I think everyone knows that the oxidation, when we open up, I have to finish it one shot, make sure all the vitamins are not being oxidized, and I have to drink it one shot and try not to keep it. And I do not know after keeping it for how long, my nutrient loss. Okay, and for liquid, we have to add more stabilizer or and some non-harmful preservative to make sure everything is stabilized. But for powder, it is very easy for us to bring around. And it's so light. I can take it anywhere. We just put it in our mouth, dissolve it, and that's it. And the absorption is much faster than the liquid in our tongue. Okay, so now we are moving towards the convenience of it. So I think, okay, I'm a mother of two. Okay. Any mothers here? I think everyone can relate. I think not only mothers lah. Sometimes adults, elderly. I have difficulties. Honestly, that is reality. I know that is very important for us to consume vegetables and fruits. I know phytochemicals. Yes, okay. But how much is my kids taking, or elderly, or all this? How much are we taking? Are we taking adequately? And it is so difficult to make. We have to think of different ways to promote and to force them, like kind of like force them to shuffle down all this goodness. Okay, all they are good. They are not doing bad, but it's so difficult. Generally, it's so difficult for them to take it. So, any moms here? Okay, I believe us. Sometimes I try all my ways to put juice lah, make juice, blend juice, cold press juice. Yes, it's easier for them to drink than to eat. Okay, one thing, to get all the phytochemicals, I need the fiber, the skin of the fruits in that to get the maximum benefit. Okay, so what you add in your juice? Okay, to have 1 cup of this, I have my apple, orange, different colors. Okay, all the different colors of all these goodness, fruits and vegetables. Yes, okay, to get adequate phytochemicals. The problem is by taking 1 or 2 single fruit, 2 or 3 fruits one shot, are we taking enough adequately? This is daily consumption, okay, because phytochemicals here, this is maybe later on you all can read from the slides here. They have different, very different by colors, by their functions. They have different properties here, and they have different functions as well towards our body. Okay, so are we taking enough in terms of the amount, or are we taking enough in terms of the variety? And is it easily available in my nearby grocery store? And where are these origins? Are they organic, or which country they are from, or are they still fresh when it is being sent to my doorstep? And is it available around? And the price, of course, some of the superfood, actually most of the superfood, if we know the market price, it can be pricey if I am to cover up all my phytochemicals. And are they easy to prepare? Imagine my blender or my cold pressed juice. I have to clean, I have to peel, I have to wash, I have to, yeah, you name it. And this is daily. So I really salute all the mothers who can prepare juice for their family member. These are all hard work. Okay, but I'm not here to degrade your effort. I'm sorry, I'm not here to degrade the effort. But it's another problem. Sugar content. Okay, for doctors, especially for health screening doctors, I am very concerned about our sugar intake, because our sugar intake generally for our lifestyle nowadays, it is getting higher and higher. Apart from my main meals, my bread, my rice, my pasta, my noodles, okay, and all the other maybe desserts, pastries, or juices, or yeah, there's a lot of good food around, processed food, good food around. So by this American Heart Association guidelines, they advise men and women not to take a daily added sugar. This is the added sugar, extra sugar, not more than, for men is 36 grams, which is 9 teaspoons. And if I'm not mistaken, it is around maybe a can of Coke. Yeah, just a can of Coke is more than that. For women, 25 grams or 6 teaspoons is lesser than a can of Coke. Even my ketchup, they have a lot of added sugar as well. So fruits, okay, some say, fruits, they are natural products. Yeah, a lot of patients ask me that question. Okay, they are natural products. So these are not considered sugar. Okay, honey, sugar, my brown sugar, my white sugar, my rock sugar, my fruit sugar, they're all sugar. Yes, they fluctuate my blood sugar level, which it is what we do not want. Okay, when I have a lot of sugar overload in my bloodstream, this can cause a chronic inflammation. Okay, chronic inflammation, we don't feel anything, but eventually it will lead to, okay, my overuse of my pancreas, that is diabetes. Later on, my high blood, and all the sugar, they attract fats, and some they turns to fats in my bloodstream, the oil in my bloodstream. And all these can cause an organ damage, stroke, heart attack, and I will elaborate on that later. So just by looking at grapes, now I know grapes is good, grapes are expensive. Okay, one cup, a small cup, it is a good 23 gram of sugar. They're delicious, yes. And these are the fresh one. Not to say those, sometimes they sell it, the concentrated, maybe they add some other added sugar to make it tastier. So we have to be very careful in the sugar intake. So if I am, okay, like example, I'm taking an apple, some pineapple, oranges and grapes for my phytochemicals. How much of sugar is that in just one cup of it? How much can I'm consuming? Okay, and I'm not here to, if anyone familiar with these drinks, okay, I'm not saying which brand. I used to, my kids love it. I used to love it. Okay, but until I read about, okay, this brand, I'm not saying which brand, they are well known to serve raw, fresh fruits with no added sugar. Yes, they're healthy. But with the original size of 550 mils, a small cup, my extra after my food, maybe I walk at the mall, I want something extra to quench my thirst. Uh, just an example, maybe a mango. I love mango. It's a tropical fruit. It's sweet. It's nice. And we are looking at, let's say, Soraya favorites. It's the mango nectar and things like that. It is with honey. It is a good 93.7 gram of sugar in 500 ml. Yes. Excluded whatever I take for maybe my lunch, I take noodles or rice. And even the veggie garden, okay, it's all greens and with one orange. Only one fruit, and they are all greens. Greens, they have very minimal sugar. It accounts for 26.5 gram of sugar. So if I'm taking any of these every day, how much of sugar I'm taking? And my kids and my parents And yeah, yes, I need phytochemicals. So I want the goodness of the phytochemicals, but I do not want that much of sugar and hassle. So let me introduce. Okay, this is what we call JoeGenEx. Is in sachet form, in powder form. They have 36 good superfood from fruits and vegetables. All this goodness, they give us more than 1,000. Okay, yeah, 1,000, more than 1,000 types of phytochemicals in one sachet, and an affordable price and hassle-free. Okay, so this is JoeGenEx. Thanks to Dr. Joe, the creator of JoeGenEx. Okay, he is a doctor in leading experts in the field of epigenetics. Remember, just now I mentioned about how my gene expression. Yeah, that is epigenetics. I want to express the good genes to suppress my bad genes. Okay, so he is the leader of the epigenetics field, and with a lot more than 40 years of studies, more than 10 years of clinical research, he found the best golden ratio, okay, with a different combination. Okay, they have specific combination. So all this, the whole sachet with 1,000, more than 1,000 phytochemicals, they give the best and the best positive impact towards my gene expression. It's not only phytochemicals, it's about my gene expression. So thanks to this Dr. Joe, that's why it is named JoeGenEx. It is Dr. Joe. Okay, Gene X is gene expression. Okay, so this is our products, JoeGenEx, and a lot of clinical backup with a lot of clinical research and papers and clinical trials. This is his golden ratio of the combination of fruits and vegetables. Okay, so our body, we have more than 22,000 groups of genes. Every one of them, they have different switch to on and off. To off, to block it, which is to block it, some, and some I want to enhance it because it is good for us. So that meaning that I need to have different types of phytochemicals to promote these genes to off and on their own, and to enhance my health, make sure I'm healthy, and I do not want to express that much of my bad genes. Example, obesity. Example, familial hypercholesterol. That means family genetically high cholesterol or high triglyceride. This increase my risk of end organ damage, high blood, a stroke and heart attack. Yeah, end organ damage. And all this obviously, yeah, and the cancer cell. The breast, we know that it is genetics. Breast cancer, especially breast cancer, lung cancer, colon cancer. These are a few examples. So if I'm taking all this one shot and we can suppress it, why not? Okay, so what is in this JoeGenEx sachet? So every sachet, we have more than 26 superfood from vegetables, groups of fruits, and more than 1,000 phytochemicals per sachet. That is a lot. I do not know how much of drinks or cups of juices I need to take. And yeah, I think people will be worried about how about the sugar? This is the what they calculated, our calories and nutritional information. Per sachet is 11 kilocalorie. It is very minimal, and the carbohydrates is 2.7 grams. It's very, very minimal with all these different kinds of 36 superfood in one. And these are all the listed extract here. And easy for us. It's just a very light, small strips. I can take it everywhere, anywhere, all walks of life, anywhere. So do not need to be worried about the sugar content. And this 11 kilocalorie do not even spike much of my sugar level, and it can be taken during fasting. It don't break my fast. Okay. So, and the origins, do not need to worry about the ingredients, because all these phytochemicals, they are harvested during prime season from all different places of the worldwidely. Okay, and they are being extracted high quality and safe and reliable. Later I will mention about we have very good certification to ensure everything, the products, all of them, they give you good results and they are safe and reliable. And they are produced by GMP worldwide. These are good manufactured practice worldwidely and certified factory, and it's powder form. Okay, why powder form again, and when and how the best way to consume it? Okay, first it's easy to bring, easily available. Okay, and the powder form compared to liquid, it is less preservative or stabilizer compared to liquid. Liquid is heavy. I have to bring it here and there, even traveling. And it is less, they have less chances to be being oxidized compared to liquid. Once I open, I have to finish it as soon as possible. I think the powder, they do not fill my tummy that fast, and I just take it in a single sachet, light, and they do not make me feel that full that fast. And it is as fresh as it is being extracted because of their technology. They preserve the freshness of the food consumption. And the best is to dissolve it with my saliva and hold it around 30 seconds, put it in my oral cavity. And once I swallow, they will increase the bioavailability of the absorption of this. So it's very easy. You just open up for it. Or for those who can't swallow powder form, maybe you can just add in a little bit of liquid, just drink it fast. Everything is in, well absorbed. And you have more than 1,000 phytochemicals in just 1 minute. Yes, it's hassle-free. So, okay. So to recap, one sachet have more than 36 superfood by the colors and the fruits and the vegetables category, and more than 1,000 phytochemicals in it. Okay, now I would want to introduce the two special ingredients. Okay, I very strong anti-inflammatory or antioxidant extract, which is our turmeric extract. I think everyone knows about this. It is very, very clinically proven. And green tea extract. Okay, so these are our two special main ingredients in our JoeGenEx. Okay, so these are all the listed now. They are, of course, they are very strong clinical, a lot of clinical, wide range of papers supporting. They are very strong anti-inflammatory, and also antioxidation, and in other words, anti-aging. Okay, so all this, it's not only my skin, I look young or no, it's all everywhere, my cell, my blood vessels, and my system, my heart, my lungs, my brain, and it elevates my mood and to prevent a lot of improve my cognitive level, my brain function. Okay, so it can prevent a lot of brain diseases nowadays. Okay, and also to reduce the cholesterol and certain cancers. This I will elaborate one by one in detail later on. So this is the golden ratio, as I mentioned, created by Dr. Joe. Okay, so we have these two excellent special ingredients. We have all the superfruits and top plant extracts. So most of them are not easily available. Okay, it is you need to find it and ensure it is fresh and good and safe. And fruit essence and also other special ingredients made up of 36 of goodness, and they give us more than 1,000 phytochemicals. Okay, so example okay, acai berry. Okay, one of my favorites. I always love acai powder, but it's only a single phytochemical. I have to buy the powder, I mix it, or I have my acai bowl elsewhere, and they will add up with a lot of other berries and everything. Actually, my main concern is the sugar content. Okay, I do not like too much sugar. I do not like it. So, so acai berry here, they extract it without taking in account of the extra sugar. And acai berry, this is proven to be a strong, very powerful antioxidant. Okay, and it is proven scientifically to boost my brain function for dementia patient especially, and to increase my mood, and to protect my heart and prevents cancer. And the other one, example, mangosteen. Okay, Mangosteen, usually we take the flesh inside. Okay, we have sugar. Of course, the flesh inside, it is full of vitamins, of phytochemicals. But what we neglected is the peel of it, the skin, the external peel of it, which we can't eat. If I'm not mistaken, it's kind of bitter. I tried it before, accidentally. Okay, so it doesn't taste good, and it tastes weird. So we are not supposed to eat it. So this skin peel, in fact, they have the highest level of phytochemicals and vitamin inside. Okay, it is a very strong, powerful antioxidant. And this phytochemical from the mangosteen peel, they can actually kill microorganisms, bacteria, fungus, especially in our gut health. It protects my gut health. So every different phytochemicals, they act differently on different system. That's why we need a lot of variety. Okay, so it is quite difficult to eat it all daily. Quite difficult. So with one sachet, we can do all that. Okay, so let's look at what are the main why I love phytochemical that much. Okay, so the first is to boost our immune system. Okay, imagine as I say, phytochemicals originally is from the plants. Okay, the plants, it is to boost the plant's immune system, to protect them against anti-microorganism, bacteria, virus, fungus. Yeah, it is from the plant. So if we take it plant-based, it is good for us. Okay, it boosts our immune system as well. It will kind of like signal our immune system army to work, especially in immunosuppressant group, like my kids. I give it to my kids, elderly, or those who are not taking adequate vegetables or fruits daily. Okay, and a lot of research studies shows that they have anti-microorganism. Organism here is mainly bacteria, virus, fungus, parasites. Okay, what we do not want it. Okay, so they actually have some of this property. Okay, and traditionally, a lot of the countries, they take these phytochemicals as a medicine in the older days. The medicine to reduce or to suppress certain infection. Okay, of course, those very serious, I will still ask you to go to hospital. But if for my daily health maintenance, it is good for us. Okay, so for example, especially it's very effective for respiratory infection and gut gastrointestinal infection. They have studies supporting that, especially COVID-19. Okay, so how they act it? We have act on this virus or bacteria. Okay, first, they will suppress the activity of the bacteria and the virus. They suppress it at a certain extent, and they will destroy the rigid wall. Okay, they have this chemical will destroy the wall of it naturally, and they also release toxin, a cytotoxin, to kill the microorganism, and also to detox whatever bad substance from the infection. Because sometimes these substance from the infection, they give you bad, as in bad benefits, to bad consequence to my body. So they try to detox or excrete all these bad substances and to suppress the infection. So this is antimicrobial properties. So apart from the anti-inflammation, antimicrobial, they also they ease symptoms. They have research studies showing that they ease symptoms. For example, common cold. I have some viral infection, okay, which is not too serious, but I want for my health. Okay, so they will break down mucus. So I have sticky mucus. They will try to lyse the mucus, but phytochemicals does that, and they can also ease certain symptoms, what we call bronchodilation. When we have some infection, there's a lot of mucus and inflammation going around. I feel so tight at my lungs and my chest. I couldn't breathe smoothly. So they kind of like open up my lungs, open up. So it will ease. It's not only boost my immune system or anti-microorganism. They also, certain extent, they will ease my symptoms. So I do not need that much of medication actually. Okay. So the second thing is a good antioxidant effect. Okay, it is proven. It is proven. It is all by clinical research studies that is proven. Antioxidant. Okay, there's a picture showing. Okay, what is antioxidant and this anti-inflammation for? Okay, we have to understand this is my cell. Back to my basic structure again. We have so much of free radicals outside from my stress. Okay, I have a lot of work stress, family stress, work stress. I have toxins. Okay, it can be the cigarettes, the petrol, the air, the pollution, chemicals from my food, my processed food. I do not eat, I admit that I do not eat healthily. Okay, all the chemicals or radiation around it, my lifestyle. Okay, basically my lifestyle. So they produce these free radicals, and these free radicals damage my cell. This is proven. They damage my cell. But are we taking any? Of course, I need antioxidant. It's food. I'm not taking medication because we don't feel anything right now, but we try to reverse the damage. So all these antioxidants from the phytochemicals, they actually attach to the free radicals and to neutralize it and make sure it is reversible. So in short, this is not only antioxidant, this is anti-inflammation, and subsequently all these cause cell aging. So they, for long term, they reverse or they prolong my cell aging process. They try to reverse it, try to make us as young as possible. Okay, by taking phytochemicals. So all these they are proven. They are proven to be beneficial in all the clinical studies. Okay, so apart from that, okay, they also promote cell metabolism. Okay, what is cell metabolism? I think we heard about a lot about metabolic diseases. Okay, example, I have my high blood, my diabetes, my cholesterol, high triglyceride, my fatty liver, all these visceral, these are all the metabolic diseases. Okay, it don't happen overnight. It happened over the years. And of course, how fast it depends on my lifestyle and my genetics and my race. And there's a lot of factors in it and my lifestyle. Okay, so all these metabolic diseases, once triggered, they are like friends. 1, 2, 3, 4, 5, they come in together. They cause chronic inflammation, and for long term, they age our cell, our system prematurely. That's why we have all these diabetes and high blood patients getting younger and younger. Okay, and all this can be complicated with an organ damage if I do not take care earlier. An organ damage as in I have heart attack. That's the end of it. I have stroke. I have vasculitis of my brain. That means maybe I have dementia. Or Alzheimer, or I have my eyes problem, okay, slow blindness because of this disease. All the vessels getting bad in my eye. Okay, so they have blindness of it. Okay, so these phytochemicals, they are proven to reduce how? Okay, to reduce by how? Okay, so they can promote my other cells, my pancreas cells, my muscle cells to uptake my sugar from my system. So when your cells take up more sugar from your system, leaving your blood vessels, the sugar content in your blood vessels is lower. That means stabilize or to reduce your blood sugar for long term in that way. Because when I check my blood sugar, that's it. That is my our level. So they promote other cells to take up a lot of sugar from my blood. So my blood sugar reduce. Okay, that is number one. The second thing is they have this compound that phytochemicals, they proven to regenerate our beta pancreatic cell. Okay, for long term, meaning that once I have insulin resistance, I have diabetes. Okay, this is type 2 diabetes, not the type 1 diabetes. This is type 2, majority of us, and is associated with visceral fat, fatty liver, obesity. So all these, my pancreas cell destructed more than 70%, I have diabetes. That's how my sugar level is so high. Okay, so sometimes these phytochemicals get to regenerate my pancreatic cell, maybe not towards 100%, but trying to delay the risk if I'm in a high risk or I do not take care of myself, to delay the progression of going into diabetes. Okay. And apart from that, phytochemicals, they have compound that relax my blood vessel muscle. It is what we call smooth muscle. My blood vessel, the muscle of it, they relax it. So after your blood vessels, they relax, what you happened? Okay, your blood pressure is being more stabilized. And in another words, it is cardioprotective because you have your heart do not need to pump so much to counter your blood pressure. Okay, so your heart is pumping in an easier way, is protecting your heart, protecting your brain from being stroke because of the pressure, unstable pressure. So for long term, it's actually beneficial apart from taking the phytochemicals. This is proven beneficial. And certain substances, certain phytochemicals, example aloe vera, which is in our sachet, they have effects in reducing liver fat, fatty liver, reducing for long term. That is visceral fat, okay, by suppressing the gene that accumulates fat. They suppress the gene, not to express it so much, to reduce the fat accumulation at my liver. Okay, because all these fatty liver, for long term, they are highly associated with diabetes. As I said, they're all friends. So the rounder my abdominal circumference is, the higher risk of my having a visceral fat, having diabetes, having stroke, having heart attack. Yes. So these, for long-term phytochemicals, they can actually help in our metabolic diseases. This is metabolic disease. Okay. And lastly, I think they are good as well, and it's proven. Okay, they can help in fighting cancer proliferation, cancer cell proliferation, and to reduce the impact of carcinogens. What is carcinogens? Carcinogen is the toxins from environment, from elsewhere, which can promote cancer formation. If even under we do not have those cancer risks, okay, they can cause cancer formation. So we know that sometimes genetics, we can't run away from it. We have certain risks of having certain cancer. We can't run away from it. We can't choose. So these phytochemicals, they can help to prevent. So this is called chemo prevention. Chemo is chemical. Prevention is to prevent cancer cell. I wouldn't say 100%. I couldn't promise 100%, but they, to a certain extent, they can help to prevent it. Okay, by preventing initiation at early phase, initiation of this cancer cell. And even after initiation, it is being promoted already. They try to reduce the promotion or the subsequent progression. Okay, and it's suitable for everyone. Okay, even what we can say primary, secondary, or tertiary prevention. Like primary prevention, those with no cancer, or those we already know that we have risk of certain cancer. Okay, this we can prevent it earlier on. At least they try to suppress the gene expression as much as possible. Okay, and secondary prevention for those already who have precancerous lesion. Certain lesion, they are precancerous, but they are not cancer at the moment, but there is a risk as years goes by, they might go into invasive cancer. They might. Okay, so this can actually help as well. Phytochemicals help as well. This is secondary prevention. And tertiary prevention is for those ongoing. They are curing it. They are battling, they are struggling to battle this cancer cell. Okay, to help, at least to help them by the vitamins, by the phytochemicals, and to stabilize the proliferation, make sure it don't go into further invasive to spread that much, to delay it. And for those who recovered, they also to prevent recurrence of any cancer. Okay, so for example, I have a lot of clinical studies supportive that especially like lung cancer. Okay, loads of phytochemicals, they can help to induce apoptosis. apoptosis is a self-destruction mechanism. They destroy themselves, lah, put it that way, lah, self-destruction by the bad genes. So they will promote this apoptosis mechanism for the bad genes to destroy themselves. Yeah, they put like a bomb for them to kill themselves. This is good. It's like suicide. Okay, so they will kind of like make the lung cancer genes to kill themselves. Okay, and they have wide range of studies to show that they will suppress the genes. I believe everyone know about breast cancer genes, lung cancer. These, they can all be suppressed, wide range, from breast cancer, different phytochemicals, breast cancer, lung cancer, female, male reproductive system cancer, my cervix, cervical, my prostate, cancer, bladder, kidney, liver, oral cavity, leukemia. Yeah, you name it. There's actually a lot, but by different phytochemicals. That's why it is good that we take as much as possible phytochemicals. And in one sachet, it is more than 1,000. Okay, so now we think back, how much of vegetables and fruits I'm taking today? Are we taking adequately? We ask ourselves honestly, lah. And my kids, okay, I know my kids is not adequate, and my parents, okay, and getting the safe products. I do not want that much of sugar. Okay, so are we taking correctly in terms of amount and variety, different colors of it? So with all the hassle, I think that it is good to have one or two of these sachet easy for us, convenient for us to have, enjoy all the goodness of it, more than 1,000 of phytochemicals in it, with all the superfood here. Okay, so this is some testimonial. Okay, this is Mr. Okay, I know that the triglyceride, if you are a regular, you are regular in doing your health screening, you know, triglyceride is mainly because of high sugar. They switch to be a kind of oil in my blood vessels. They block the heart. Okay, so normal range is less than 1.7. Okay, I have seen a lot of for those who do not take care of, not health conscious enough lah. So they exploit their body. Maybe they binge drink beer, a lot of fruits, durians, mangoes, all the sugar they eat. They just with a lot of high visceral fat, because sugar turns to fat. So most of the level, the highest, I would say, because of dietary itself, it goes up to 4. The normal level is 1.7, 4 or 5 or higher. But for this man, he started off with 12. Oh my, 1.7 is a normal range. 12. Is it because he is eating, binge eating? Or maybe high chance he's having what we call familial, that is familial is a family history, hypertriglyceridemia. That means hyper is high, triglyceride is this oil, demia is in the blood. So this might be something genetics, okay, in his genetics. So for us, sometimes he try as much like fasting, diet, try to starve himself, everything every day, it might reduce, but maybe the level is not as expected to a good range, because this increase his risk for stroke and heart attack. So most of the time we give fenofibrates, we give medication, and he might experience certain side effects, and you have to monitor the liver and everything. So for him, after taking 2 months of I believe it's JoeGenEx, his triglyceride dropped to 2. So this is 7-fold the normal value. 2.6 is quite acceptable, but it can be further reduced. So within 2 months of JoeGenEx, you can see that his gene is being suppressed. Okay, and this is my family member. Okay, my family member. Okay, not to say I'm sorry if they are listening. Okay, my mom and dad. So this is his earlier on, his before starting JoeGenEx, his pre-diabetes. My father is 70 years old, so I do not want to controlling about his food. So I would just say you pandai, you see yourself, try to control yourself, but not to go into diabetic range. Okay, so by end of May, and this is his end of July results. Okay, so there is an improvement in HbA1c. HbA1c is the average sugar for the past 3 months. Okay, it is not affected by his recent fasting diet. It is very stable for the past 3 months. So there's a reduction, and this is my mother. She has diabetes. Okay, she has over the years this family history as well. So for her as well, her HbA1c is always 5 point something, which is quite good. So her normal value is 5.6. So after taking for 2 months, it slowly reduced to 5.3, further reduced as low as possible. I'm happier to see that. Okay, this is my parent. That's why I'm very happy with the results without changing their usual lifestyle. Usually they take in moderation the food consumption. Okay, so why are these products it is so safe? Because it is being certified by this Japanese Association of Preventive Medicine by Japan. Okay, it's a group of 6,600 registered doctors, a group of them, and they were certified for those products which is the best in the field. So if they are the best in phytochemicals, they are being awarded with this certification, and you need to renew it from time to time to make sure the quality and everything, and with a good clinical outcome is there. So first, how to pass through this association? First, it must be pure functional food from your food, and there's no drugs or any preservative or side effects towards it. And clinically, it must be proven healthy and stable. This product is stable to import everywhere. This is a search engine, PubMed, a medical search engine. Okay, we can see that about phytochemicals, they have more than 20,000 different research, okay, related to phytochemicals in gene expression. It is not new. Okay, this is not new. So our science, our health science is going towards phytochemicals nowadays. Okay, so start early. Start early. Okay, so we have a lot of things we can start reading, all very well established research here. Okay, so what are you waiting for? This is something very good, and I think everyone should take care of their health early. Okay, Yvonne.
Oh, okay. Thank you so much, Dr. Chia, for sharing about JoeGenEx, about phytochemicals, about epigenetics. So I'm sure everyone really learned a lot from this session. Even myself, I learned so much. And after hearing so much about JoeGenEx, I quickly took one myself during the call as well. Because I was like, oh, so much goodness. So, everyone wants to, have turn off their bad genes, turn on their good genes. You want to be healthy, you want their immune system to be stronger. Even, kids also can take this product. Even our parents, whether 70 years old, 90 years old, they also can take this product. So it's really for almost everyone. So I've always also seen a lot of people around us that really benefited from the products, whether it's the eyes, whether recovering from COVID, whether it's even the kids having a very stronger immune system, like they go to school, they don't fall sick as easily. So many testimonials. So you can really see that this product is something that can really help everyone. So why not share the goodness of this product to everyone you love? So not just yourself, not just for your family, but also your friends and also people around you that you think might need this product. And we also have a very good promotion this month. So I think it's a bulk package promotion, 6 months promotion, 3 months promotion. So talk to the person who invited you to this call today to find out more about how you can actually start on this product. If you have tried it already, share the goodness to other people. And if you haven't tried it, what are you waiting for? Get one today. Okay, so thank you so much everyone for being here today with us at Power Monday. So we will also have another session next week, actually every Monday at 8:30 p.m. So thanks everyone for tonight, and we'll see you again next week. Okay, bye.
Bye.